Hey guys, welcome back to the channel. Today we are going to be looking at the basic periodontal examination, the BPE. The BPE is basically a basic screening tool for determining a patient's periodontal condition. It's a simple technique that should be performed on all patients in order to rapidly identify any periodontal problems. A thorough examination of the periodontal tissues is an important part of patient care. The BPE is a simple and quick screening instrument that is used to determine the level of further investigation and treatment that is required. These BPE guidelines are not prescriptive, but they do constitute a basic level of care for periodontal evaluation. BPE should only be used for screening purposes and not for diagnosis. When interpreting BPE scores, the clinician should use their expertise, knowledge and discretion, taking into account aspects that are unique to each patient. In some situations, such as when there's a lack of patient engagement or false pocketing, it may be permissible to deviate from these rules. The BSB document by the British Society of Periodontology. There are also guidelines for periodontal screening and care of children and adolescents under the age of 18, has guidelines for using BPE in younger patients, and the link can be found below in the description. So what instruments do we use to do the BPE screening? Well, we use a probe called a CPITN probe. It was utilized to conduct the examination, also known as a WHO probe. This probe was created specifically for this exam. The tip of the probe has a 0.5mm ball. Then there's a black band that runs from 3.5mm to 5.5mm. followed by a black band that runs from 8.5mm to 11.5mm. What is the best way to record the BPE? The dentition is divided into 6 sextants, with the greatest score recorded for each sextant. The upper right corner comes from the second molar to the first premolar. What is the best way to record the BPE? Number 1. The dentition is divided into 6 sextants, with the greatest score recorded for each sextant. The sextants are divided into the following: from the upper right second molar to the upper right first premolar, the lower right second molar to the first premolar, anteriorly from the canine to the other canine, lower from one canine to the other canine, upper left from the second molar to the first premolar, and on the lower left from the second molar to the first premolar. Each sextant's teeth are checked, with the exception of third molars, which are not examined unless the first and second molars are absent. A sextant must have at least 2 teeth in order to be recorded. A BPE probe from the World Health Organization, which has a 0.5mm diameter ball end and has black banding ranging from 3.5 to 5.5mm. It's best to use a light probing force of approximately 20 to 25 grams. In each sextant, the probe should be walked around the teeth before going on to the next sextant. All locations should be reviewed to ensure that the highest score in the sextant is recorded. If a code 4 is found in a sextant, continue to inspect all of the sextant sites. This will aid in gaining a better understanding of the periodontal condition and ensuring that any furcation involvements are not overlooked. What do the scoring codes indicate? A score of 0 is recorded when the pockets are less than 3.5mm. So there are no calculus or overhangs present, there's no bleeding on probing, and the black band are entirely visible. BPE score of 1. This is where the pockets are less than 3.5mm, no calculus or overhangs, there's bleeding on probing, and the black band is entirely visible. BPE of 2. This is where the pockets are less than 3.5mm. There's supra or subgingival calculus and overhangs present, and the black band is entirely visible. A BPE of 3. This is where the probing depth is between 3.5 and 5.5 millimeters. The black band is partially visible, indicating pocket of between 4 and 5 millimeters. BPE of 4. This is where the probing depth is greater than 5.5 millimeters. Black band disappears, indicating a pocket of more than 6 millimeters. And an asterisk. This is where there is a furcation involvement, and this can be applied to any of the other BPE scores. If a patient presents with a BPE code of 3 or 4, then more detailed periodontal charting is required. If a patient presents with a BPE of 3, then initial therapy including self-care, advice, oral hygiene instructions and risk factors are to be eliminated. Then post-initial therapy, record a 6-point pocket chart in that sextant only. Whereas if there's a BPE of 4 in any sextant, then record a 6-point pocket chart throughout the entire dentition. There are also many limitations of the BPE, and one of them is that it cannot be used to monitor the response to periodontal therapy, because it does not provide us with information on how sites within a sextant changes after treatment. To assess that, we need to be carrying out a 6-point pocket chart before therapy and after treatment to see what the treatment outcomes are. Also, it's important to note that BPE should not be used around implants. As an adjunct, radiographs should also be taken for patients who have BPEs of 3 and 4. The radiograph should be able to determine the crestal bone levels, and most commonly, periapical views will be required for patients with BPE scores of 4. Bleeding on probing should also be recorded in conjunction with a 6-point pocket chart. So how do we treat patients with? After recording the BPE, the patient can be provided with a specific treatment plan, guidance on interpretation of BPE scores. So if a BPE score of 0, then no need for periodontal treatment. BPE scores of 1. This can be managed using oral hygiene instructions and improved brushing techniques. BPE of 2. Again, oral hygiene instructions, better brushing techniques, plus removal of plaque, retentive factors, removal of tartar, including all supra and subgingival calculus. BPE of 3. As for BPE of 1, 2, and root surface debridement, if required. BPE of 4. Oral hygiene instructions, root surface debridement. Assess the need for any more complex treatment, such as surgical flap. The asterisk indicates furcation involvement. This has to be managed according to the BPE, either 0 to 4. Well, thank you very much for listening. We hope you found this presentation useful. If you have not already subscribed, please click on the subscribe button. Please like and share, and we will be bringing more videos for you in the near future. Thank you very much for watching. Bye bye.